Hi, I'm Donna Paradowski, and I am a nurse practitioner consultant for home living and continuing care. I've always known I was going to be a nurse. I was one of those pathetic people at 8 that always knew exactly what I was going to do, and I have master's level training, 11 years in total actually. It gives me skills in which I'm able to make medical diagnoses, I'm able to order prescriptions for the patients that are in my care, and I particularly look after chronic disease clients. The world's our oyster right now. I think there's a lot of mobility, and people are always surprised that we come to them in their homes because we're dealing with people with really low mobility issues. And so we get called in and we basically are like Sherlock Holmes. But the wonderful thing about being able to go into someone's home, you get to see the environments that they're living with, the barriers and the good things that are happening, the family supports or lack of family supports. You get to see what they're eating, what they're not eating. And so when you make a plan for their health, you're looking at the whole picture, and you're able to do that because you're in their home. And I can make referrals on to specialists as necessary. But that really is ultimately the way. No one person can know everything about health care. And so I think once we pool our resources together, that's really how a person's going to advance in their health. I've been working as a nurse for 26 years, and I have to say this is one of the best environments that I've had the privilege to work in. We have a good rapport with one another, and we have respect for each of the different disciplines that work within our office. Previous to coming to Alberta, I worked as a discharge coordinator in the community in Dawson Creek in northern BC. I felt that I needed to be near a university to combine some of my interests, and some of that is research. And I have two good-looking, exhausting, athletic sons. We're scooting around oftentimes, yeah. And there's a lot of really wonderful things to do, the folk fest, the theater. I tell you, the people are warm and friendly, and it feels cozy. It feels cozy here. It's so exciting for me. There's so many opportunities. This area is so new. I'm expanding into research, I'm expanding into the promotion of the actual program, the education side of the program. I see it as an opportunity to actually put this program on more of a world map. Yes, I could have moved other places, and I did consider other places, but they did not have the opportunity for me to use the type of nursing background that I had. And this place was one of the only places that offered that. I love my job. I'm really lucky.